Okay guys, so since most of you are going to be going to college next year, university, you will be more susceptible to seeing different kinds of drugs, whether they be prescription or illegal. And so today I just want to inform you guys on Concerta, which is an ADHD drug, and many youth, even your age, use it as a way to better their academics, but I'll get to that after. So let's just begin with what it is exactly. So it is a prescription drug designed to help increase levels of dopamine in your brain and decrease impulsivity and hyperactivity. So impulsivity is just I'm going to do something without thinking of behaviors or consequences, sorry. And the hyperactivity is just when you're super hyper and uncontrollable, just when you get into that silly phase. And where does it come from? So it comes, to be specific, it's called methylphenidate, and it's made up of synthetic compounds, which are just chemically made ingredients put together to make this drug. And just to begin, I want to show you a video just to explain more in depth on ADHD and what it is exactly.
When you first find out that you have ADHD, it can be a little confusing and nerve-wracking. ADHD, or Attention Deficit Hyperactivity Disorder, can cause problems in many different areas of life. Millions and millions and millions of children and adults all over the world are diagnosed with ADHD. That's a lot of people, so you are not alone. Myths, mysteries, and misinformation surround ADHD. However, we know it's more than just inattention, impulsivity, and poor organization. People with ADHD have deficits within areas of executive function that can affect them in many other ways. Let's take a closer look. Imagine what it takes to film a movie. There must be lights, actors, props, and scenery, and a camera. In order for the action to come together, someone has got to call the shots and be the boss, a director. A director on a movie set does what executive functions do in the brain: the ability to plan, organize, prioritize, sequence, manage time, and problem solve are just some of the skills needed to complete a task. But for the person with ADHD, the executive functions are not fully operational all the time. It's as though their director keeps falling asleep. ADHD is not a lack of skill or knowledge. Just like on the movie set, the actors, props, and lights are all there, but with a snoozing director, how can the project all come together?
Yeah, I simply cannot work like this. Please wake up.
Okay. Let's see what we've got so far.
When the director's awake, he can look through the camera to play the scene back. People have an internal camera in their brain, which lets them see how their actions affect themselves and those around them, in order to make sure their behavior is appropriate for the situation they are in.
Who put their dirty fingers on the camera? Oops. Sorry, boss. I gotta stop falling asleep.
There are lots of things you can do to wake up your director, clean your camera lens, and increase your confidence as you go through life. Succeed. Don't just survive.
Okay, so that was just a little video on what exactly is ADHD, so attention deficit disorder, hyperactivity disorder, sorry. And so the history of where the drug, how it was made and where it came from. So it's been around for over 50 years, and its first major usage was meant for weight loss back in the 50s and 60s. And now the usage today is intended for children 6 years of age and all the way up to adults of the age of 65. And it's mostly used, again, for ADHD and even sometimes narcolepsy, which is a sleeping disorder. And so, like I said before, methylphenidate is just the general name, and Concerta is the brand name for it. So you might have also heard of Ritalin, which is is also methylphenidate, and was first synthesized in 1944 and was tested on humans in 1954. So just when it was created. And it wasn't until the 1980s where Ritalin, so methylphenidate, was used to treat symptoms of ADHD. And so Concerta is a type of drug known as a stimulant, and stimulants help with hyperactivity and impulse control because it has a calming effect on the brain, and it stimulates the focus and impulse control parts of the brain. And so you may have heard of other types of stimulants such as caffeine, cocaine, nicotine, amphetamines. And so how long does it last for the day when you take it? So for adolescents, Concerta is approved for dosages up to 72 milligrams a day. And you usually start off really smaller, and you gradually progress depending on how it's working for you. And so if you take it in the morning, it should last for up to 12 hours, so you'll be good for the entire day at school and even after for homework. Okay, and how does it affect your brain and body? So Concerta is taken to increase one's attention span while decreasing hyperactive and impulse behaviors, and it has a calming effect on someone with ADHD. So the drug was also intended to raise dopamine levels in the brain, and dopamine is a naturally occurring neurotransmitter, so a chemical that is released into your brain to send messages from your body back and forth. And an individual with ADHD has low levels of the dopamine in the brain, and that's where the Concerta comes in. So you may have never heard of Concerta or Ritalin, but you may have heard it as something else. It can be known as Skittles, Smarties, Uppers, vitamin R, or you might have even heard it as methylphenidate. And so, like I said before, many college students abuse ADHD medication to improve academic performance. So whether it is staying up all night just to get an assignment done, or using it to get ahead, Concerta's chemical makeup is extremely similar to cocaine, and that's why it's so addictive. And that's why you have to be very, very careful, as it is very dangerous. And substance abuse is higher if your ADHD goes undiagnosed. And I have a few more videos concerning youth with ADHD medication. So here's the first one.
I think that more than 1/3 of college students take attention deficit drugs without a prescription. They say it helps them focus or give them more energy to study during stressful times at school.
But they often get the pills from their pals who have properly prescribed the medicine. Schools around the country are buckling down on this buddy system of swapping stimulants. And as ABC News' Charlie Crossman explains tonight, some claim they're discriminating against those who truly need the drugs.
What would you do if your doctor asked you to sign a contract the next time you prescribe medication? Or what if you were required to submit to a drug test in order to get a prescription filled? It's happening in some college clinics around the country when students look for help treating attention deficit hyperactivity disorder, or ADHD.
These are unfortunate kind of barriers for those who need the treatment.
Studies document rampant misuse and abuse of ADHD medications on college campuses. This student, who asked that we not share his identity, explained he didn't get his first prescription until his first year of college.
I had a bunch of friends that were on them, and I had taken some of theirs, and that helped me.
So he asked the doctor to write him a prescription.
I've never sold them, but I have given them away.
And that's the problem. Schools are having a hard time keeping up with the demand and the expense for treatment and diagnosis. And they're concerned about medical liability, so many are now taking up new policies.
Recently, a number of campuses have announced that they will no longer prescribe stimulant medication for those students with attention deficit disorder.
Those schools are leaving it to the student to get their meds back home or off campus. Other schools say they'll fill the scripts but won't do any diagnosing.
They base it on the fact that it has been diagnosed in the past.
Still, other schools are making to get their hands on the drugs, even for those already diagnosed. Students have to meet certain testing requirements, which often include signing a contract.
It states that they will notify us if they are prescribed medication by anyone else, if they are on any kind of other addicting kinds of medications that would mix. They promise that they will not abuse any drugs. They promise not to share or sell their medications to roommates. And importantly, they promise to follow through with therapy.
The contract also gives consent for periodic random drug testing.
If we think somebody might be coming in and getting a prescription so they can sell it on the street, that allows us the opportunity to determine that they're truly taking the medication.
But not everyone agrees these changes are good. Ruth Hughes heads up the advocacy group Children and Adults with Attention Deficit Hyperactivity Disorder. She's
I'm just going to show you the other video.
Teens abusing prescription drugs. A new study found that next to marijuana, prescription medications are the most common drugs that teenagers use to get high. Another study out today found that teens abusing ADHD medications increased by 76% between 1998 and 2005. Joining us now is pediatrician and spokesperson for the American Academy of Pediatrics, Dr. Alana Levine. Good to see you this morning. Why is it this drug that we've seen such a spike in over the years of kids using these ADHD drugs?
I think that we're seeing more and more use of ADHD drugs in general because there's an increased awareness for children that do have problems with attention, and I think parents want to help them to sort of maximize their performance. But the more we prescribe the medication, the more it's sort of out there in the community, and the more there's a risk for abuse.
So what kind of high are these kids getting from these ADHD drugs?
Well, it's really more of a performance-enhancing type of high. So they want to study harder, they want to be able to focus better, they want to be able to stay up later. There are also some people who take it for the appetite suppressant qualities. So they want to not be hungry during the day and try to lose weight, and that's another reason why it's taken.
So are we saying that these drugs are safe, they're unsafe? I mean, you really, I would think, have to be very particular about what's on the labels of these things.
Right, and that's a really important point, which is when these medications are used properly and the way that they're prescribed, they are really, really safe medications. What we need to really educate our teens about is taking them when they're not prescribed or in quantities that exceed what's recommended.
Okay, how would a teenager typically without a prescription get their hands on these drugs?
Most commonly, actually, from friends. They give them out because they say, hey, this is helping me, let me help you out.
Big problem here, too. Parents really need to kind of be on the lookout.
That's right. I mean, I think that parents need to be on the lookout. They need to talk to their children. Say, even though it's a prescription and your friend may have it, if it's not recommended for you, don't take it. And I think if we can really start to get that message across to teenagers and show them that this is dangerous, not safe, maybe they'll listen to us.
And that's the one thing I want to ask you. Kids that are watching right now, that are even thinking about doing this, or have friends that have done it, how dangerous is this if you don't need the medication to be using it recreationally?
It really can be dangerous. In fact, in some circumstances, before we as physicians put children on these medications, we screen them for heart disease, do EKGs, so you really want to be careful before you just pop one of those pills.
All right, Doctor, thank you very much, Dr. Alana Levine.
Okay, before I go on though, does anyone have any questions? No? Okay, if not, just let me know. Just put your hand up and I'll be sure to answer. So some of you might be wondering, why would someone abuse Concerta? So individuals living with ADHD who are once prescribed Concerta as a child or youth, if they become an adult, the effects of the drug may have altered to an addiction as our brains change when we get older. So the effects might have been different. And rather than helping the hyperactivity aspects of the ADHD, it's only creating an addiction. And it also, because parents of children and youth prescribed with Concerta begin to abuse their child's drugs, as they might find living with a child that has ADHD, it might be difficult and stressful. So they thought, well, it's helping my child, maybe it will help me as well. Individuals who are in need of an upper or a stimulant, so someone looking for a high might resort to ADHD medication like Concerta, as it is easy to get a hold of through friends, family members, classmates, etc. And any addiction or drug abuse is dangerous. So the dangers of Concerta in particular is, again, like I said, it's extremely addictive. degrees of cocaine, very similar. It can have cardiovascular complications, so heart problems. It can lead to overdose if you take too much. Some of the symptoms of overdose could be vomiting, twitching, increased heart rate, convulsions, headache, dry mouth, a manic-like state, hallucinations, paranoia, any compulsive behavior. So if you notice in a friend or family member, or even in yourself, that you're having any of these complications, that you need to talk to a doctor immediately or dial 911, as you may be overdosing, or your friend might be. People addicted to the drug should not quit cold turkey, so they should never just stop taking the drug immediately, especially if you're addicted, as it will come with severe withdrawal symptoms, and I'll get into those later. So instead, you would seek professional help, as it is very dangerous. And if someone is overdosing, call Poison Helpline at 1-800-222-1222. And if not, you can even call 911, and I'll give you this number at the end, as an overdose of Concerta can be fatal. So some of the withdrawal symptoms, you can be very irritable, so really cranky, excessive anxiety, so it can even lead to a panic attack, nausea, so you're feeling sick, to your stomach, headaches, depression, decreased heart rate, or even increased hunger. So some of the physical indications that you may be addicted or a friend may be addicted to Concerta could be insomnia, so not being able to sleep at night, decreased appetite, so you're just not hungry, irregular heartbeat, increased body temperature, increased blood pressure, things like that. And some of the psychological, so like personality-wise, you might become very anxious or agitated and just really annoyed with everything. You may be even paranoid, and your changes in mood can be extreme. So for administrating the drug, so how you take it into your body, the various ways of administrating it can be orally, so that's how it's medically intended to be taken, so taking a pill, crushing it up into powder and snorting it, diluting it, so putting it into liquid and then putting it into a needle and injecting it into your veins, taking it with alcohol to enhance the high, so a lot of youth do this to get a better high out of it, which is extremely dangerous and can have severe consequences, even death. So if you're pregnant, can you take Concerta? So there's been many studies done to see if methylphenidate is safe to take during pregnancy, but there's not been any yes or no answers just yet. So you gotta outweigh the benefits to the risks, and definitely just talk to your doctor before taking it. So some risk factors. So improving academics, like I have said before, that improving academics is one of the biggest risk factors in adolescents and young adults as yourselves, as Concerta is very easy to attain, and it will help to regain focus and widen your attention span and stay awake for longer periods of time. So maybe you're studying for a test the next day and you want to be awake all night and day the next day, you might take that. And some protective factors. So even something, as we're doing right now, I'm telling you about this, I'm informing you on the dangers and facts of drug abuse and drug abuse with Concerta. And even talking to a trusted adult like myself, that's what CYWs are here for, even a parent, anyone that you can talk to, or researching online about things. And treatment options. So there's many different options for treatment if you have a loved one or yourself addicted to Concerta. So inpatient rehabilitation. So depending on the severity of the addiction, treatment centers will offer programs that will let you stay for anywhere from 28 days to several months. The patient can receive reduced doses over a period of weeks, so you're never just stopping cold turkey or stopping it as soon as you want. You have to reduce the dosages, or your body will react negatively. And this cuts out any chance of, like I said, severe withdrawal problems and allows the body to gradually get used to your body without Concerta. And many therapeutic approaches are offered, such as pet therapy, group counseling, individual counseling, 12-step programs, yoga, and even meditation. And then on the other hand, there's outpatient programs. So if you don't have the time in your schedule to commit to an inpatient program, such as rehab, outpatient programs are available, such as family therapy, counseling, and support groups. So if you guys have any questions, please let me know. And I have a fill in the blanks sheet that you guys can do, and it has a bonus question. And it said, what year was Ritalin tested on humans? So I'm going to hand that out now. Thank you. And for you. And while you're doing that, I'm also going to hand out a little pamphlet of just all of the major stuff that we went over in the presentation. And if you miss anything, you'll have this, and you can have this forever if you keep it. It'll keep you aware of what drug abuse can do and how it can affect you and your loved ones. So I'm going to do that now. Okay, thank you guys for letting me have your time.